Do you have an anxious dog like Tula? And have you thought about using medications such as this Clomicam for separation anxiety? You may want to be cautious as this stuff has a bunch of serious potential side effects. In this video, I'm going to be showing you my top natural remedies for dog anxiety. Are you looking to learn more about natural pet health and wellness? You've come to the right place. Click the link to subscribe to Veterinary Secrets. Before we get going with today's video, I want to tell you about a brand new upcoming webinar I'm having. We're covering natural dog sedation, dog anxiety, and diseases related to stress. 5 important reasons why you need to treat your dog's anxiety. Top natural remedies for cancer, allergies, home dog dental care. Plus my top natural dog anxiety solutions. It's free. It's happening Tuesday, October 17th at 5 p.m. Pacific. You could click the link in the box below to sign up. Dog anxiety is pretty common. Tula, in fact, she has her fair share of anxiety. Tula hates being up on the exam table. She hates loud noises. She's pretty fearful now when we're walking in the trail and she's approaching a big dog. Separation anxiety, that's a serious problem for many dogs. Not just whining and barking. Serious destructive behaviors. Our dogs that just run and hide and shake anytime there's a loud noise. So yes, it is really important that you're addressing that issue, but you need to be cautious about using some of the conventional medications such as this guy, Clomicam. The most common side effects affecting up to 15% of dogs: vomiting, diarrhea, lethargy. Some dogs will have increased drinking, decreased appetite, and aggression. Some dogs can even have seizures and tremors. Hepatobiliary disease or liver disease that has occurred in some dogs who have taken this drug, Clomicam. Drug should not be used to treat aggression, is unsuitable for male breeding dogs because of an increased risk of testicular hypoplasia, dogs with cardiovascular disease, narrow angle glaucoma, or a history of seizures should also not use the drug. Clomicam is also not to be combined with other drugs that act on the central nervous system, such as general anesthetics. According to the Clomicam website, when used in conjunction with the Preventic collar or Anapril tablets, an undesirable reaction may occur. That undesirable reaction is not specified on the site or in the disclosure statement, but according to Pfizer's disclosure statement for Anapril, combining the two drugs can lead to severe CNS toxicity, including death. Not only is Clomicam, this tricyclic antidepressant, used, we also have dogs on Prozac, also have dogs on Trazodone. All these brain-altering drugs, they have the potential to have some pretty serious side effects. And I understand if you have a dog that has serious separation anxiety, whining, the crying, the house sewing, all that destruction, like it's so distressful for the dog, clearly your dog needs to be on treatment. But before you just reach for the Clomicam or some other related drug, look at some of the alternative options, look at behavioral training as part of treatment. Here are 5 options I think you should consider. Number 1. This is the amino acid found in green tea. This is L-theanine. L-theanine, it's not a quick fix. But when it's given long term, it's been shown to decrease levels of anxiety in our dogs. It does a good job of modulating some of that brain activity, some of those triggers for anxiety. Anyone who has an anxious dog should have their dog on L-theanine. A pretty typical L-theanine dose is 100 milligrams per 10 pounds of body weight once or twice daily. Tula is 25 pounds, should be on 200 milligrams twice a day. Number 2. This is a sleep hormone, melatonin. Melatonin has an array of different uses in veterinary medicine. It's a very potent antioxidant. It's being used for many of our animals with cancer. But as a sleep hormone, it can really help many of our dogs with anxiety. I have used melatonin many a time on little Tula. Melatonin is the hormone produced to decrease brain activity. That's what allows us to get ready for bed, fall asleep. Likewise, the same thing is happening with our dogs. A pretty typical dog dose, 1 milligram per 10 pounds of body weight daily, maximum of 6 milligrams per dog. And it takes somewhere between 30 to 60 minutes before you can see the effects of the melatonin. Number 3. This is valerian root, and it is great for short-term sedation. I personally have used a lot of valerian root. Tula, she's had a fair amount of valerian root. I find the valerian root to be very effective for most dogs. It works pretty fast acting. So for instance, you're going to the veterinary clinic. You want to give your dog something just so when he gets into the exam room, he's not so shaking and nervous. This is a great option. A standard dog dose, a half a ml of the tincture per 20 pounds of body weight, takes about 30 to 60 minutes for it to have an effect. Although I find most dogs respond in about 30 minutes. Number 4. This is Chinese medicine you're going to do at home on your dog. This is acupressure. The single best acupressure point that I've seen with Tula, seen with myself, it's called the yin tang point. And with acupressure, what you're doing is you're putting your finger over top of an acupuncture point. No, you're not putting in an acupuncture needle, but you are putting pressure over top of that key point. It's called the yin tang point. It's located here at the bridge of Tula's nose, just between her eyes. So I'm just gonna hold my index finger over top of that point, hold that for 30 to 60 seconds. I just kind of take some deep breaths in and out. Try myself to be very calm and centered, transfer some of that energy towards my dog, and inevitably when that happens, like, she'll stop shaking. So it is really something worth trying. If you've never tried acupressure, try that point, see if it helps your dog. This is number 5. This is the cannabinoid, one of the key medicinal ingredients found in the cannabis plant. This is CBD or cannabidiol. We're seeing it to be really effective for many of our dogs for pain. We're trying to naturally decrease inflammation. CBD has helped many of our pets. CBD is also effective on the brain. Not every dog responds. Tula responds really well to CBD though. A standard CBD dose is 3 milligrams per 10 pounds of body weight. When I'm treating an animal for anxiety such as Tula, I'm going to triple that amount. So Tula is 20 pounds. Normally she'd be getting 2 drops. I'm going to give her 6 drops. And when I give her 6 drops, she becomes darn right calm. One of the big benefits of the CBD, it's very safe and there's virtually no side effects. If you've got a dog with anxiety, it's definitely worth trying. Thanks so much for watching this edition of Veterinary Secrets. I really encourage you to sign up for my brand new dog anxiety webinar. I'm going to be going into detail covering all of my top remedies for anxiety. Plus, in this webinar, I'll be answering your most pressing dog health questions. The webinar is free. It's happening Tuesday, October 17th at 5 p.m. Pacific. Click the link in the box below to sign up.